The Unfiltered by Jade.
Jade. Welcome to The Unfiltered by Jade, where we get out of the box and dive into topics that are sidelined. I look forward to entertain, educate, and inspire. Feel free to like, share, subscribe, donate, and make everybody know about this.
Beats by RB Records.
Shopping assistance, your style, your budget. Our services include online and local shopping for individuals and businesses, personal shopping, purchasing of company and office supplies, importing and exporting small packages across Jamaica and worldwide, and helping you find unique gifts and items for all events and occasions. Contact us at 876-919-5195 or shoppingassistance2015@gmail.com. Shopping Assistance, your style, your budget. Welcome back to The Unfiltered by Jade. Today we have with us here Dr. Jeffrey DeSarbo. Dr. DeSarbo is a board-certified psychiatrist specializing in the treatment of eating disorders and general psychiatry, including mood disorders, anxiety issues, ADHD, OCD, relationship issues. In addition to psychopharmacology, he also practices CBT and Existential Therapy. Hello, doctor.
Hi, how are you today, Jay?
I'm doing great. How are you?
I'm good, thank you.
Nice. So, we want to speak about eating disorders and particularly anorexia and bulimia nervosa. So, I want you to, give us your take on it and tell us what exactly it's about, and we just talk about it to educate other persons about this.
Okay. Well, I always like to start off with, a lot of times people will say, what do you do? I say, I'm a psychiatrist. I specialize in eating disorders. And a lot of people say, oh, I need to speak to you. And the thing is, the truth is, a lot of people have disordered eating, but an eating disorder is quite a bit different. Mostly that a person with an eating disorder, what really makes the difference between disordered eating and an eating disorder is that when you suffer with an eating disorder, the typical question I'll ask my patients when I meet them is, what percentage of your thoughts, when you're not busy actively doing something, do you spend thinking about and worrying about things like food, weight, body image, calories, exercise? And most of the time, their answer is going to be 70, 80, 90, 100%. And sometimes they say, no, 200%.
Mm-hmm.
But with disordered eating, you don't get that constant obsession of thoughts about food.
Okay.
So what I usually want to look for is, to what extent are their thoughts being kind of occupied? Because the thoughts are really what causes the distress that an individual goes through with an eating disorder. It's the hardest part. It's just there all the time. It's impossible to escape. And that's, significantly affects the individual and how they function. So, yes, you were mentioning, it's particularly when people think of eating disorders, they think of anorexia nervosa, which is kind of a refusal to want to maintain a certain weight. So people with anorexia nervosa, they have very low body weights. Their body mass index we look at is usually below a 17 on certain charts based on your weight and your height. And for like children and adolescents, you'll use growth charts, and they're usually significantly low on their expected growth charts for their age and their height. And the mind kind of gets in with that, where an individual says, I can't put on any weight, or they look in a mirror, or just how they feel in their skin is they feel significantly larger and uncomfortable than what they see in a mirror, or how they feel in their skin or with their clothes. So there's a significant body image distress that goes with it, and body changes in body image perception. And they have this fear that if they, gain weight and everything, they're going to become fat, even though they may be still at a low weight. And there's a lot of additional psychological meanings behind that. And that's really the difficulty. And sometimes with anorexia nervosa, they can decide to lose that weight by restricting their food intake, eating very little during the day. And then there's a second type of anorexia nervosa, which is a binge eating and purging type. And some people don't often think that can classify with anorexia nervosa, but it can. People can eat and then purge their food from like self-induced vomiting, excessive exercise, or using diet pills or laxatives. And, it's all in an attempt to keep that low body weight. And again, that has a lot of significant psychological and medical consequences that go with it. So anorexia nervosa is very hard to treat. And it's usually because you're depriving the brain of so much of what it needs that people's brain and their central nervous system gets compromised. And usually the treatment involves restoration of weight. However, I always look at it as we're restoring the central nervous system in the brain. And, so it takes some time. It's not easy. Bulimia nervosa is when people have periods of binge eating where they're consuming significant amounts of food in short periods of time. They feel like they're in a zone. They're out of control. It's more of a mindless eating. And then once they consume this food with bulimia nervosa, they need to get rid of it. Again, they need to compensate with it. So most people think, well, that's people who, again, they binge and then they vomit, they throw it up. And that is probably one of the most common ways. But people can also be classified with bulimia nervosa when they binge and then they do something else that's severe in a compensatory way, such as, well, I just won't eat for the next day, or I'm going to do excessive exercise, or again, I'll use diet pills or laxatives or some other way to compensate for what I just ate. And it's always that compensation of doing something to kind of mitigate how they feel with what they just binged on. Because without the compensation, that's where you have people who have binge eating disorder, which is more common even than anorexia and bulimia nervosa. So that's the main thing with eating disorders, and some rough criteria of the specifics of it.
Okay, so I want to know what direct effects do the eating disorders have on a person's body?
Well, the most direct effects it has, first of all, is on the brain. So, and again, my special interest is in the neuroscience with eating disorders. So when somebody has an eating disorder, and the longer it's there and the more severe it is, there are so many studies that shows how it impacts different regions of the brain. It also impacts how the chemistry of the brain works. So people with bulimia nervosa, there's findings that, the frontal parts of their brain, which is often involved in things like the brain's reward system or kind of obsessive compulsive behaviors and thoughts, the brain looks different in people with bulimia nervosa in those regions than it does in people who don't have bulimia nervosa. And you're kind of wiring the brain. We're doing that with everything since the moment we enter this world, we're wiring our brain to think a certain way, to function a certain way. And the same thing happens when someone has an eating disorder. So the longer they have it, those brain pathways are kind of getting hardwired. And that can keep the behaviors going. And with anorexia, however, there's even more significant changes. And a person loses brain volume. And people don't often think of it this way, especially the person with the anorexia nervosa. they're thinking I'm losing weight, I'm losing body weight, I'm losing fat, but you're actually losing brain tissue and and cellular volume, and not just the brain, but the central nervous system. So thinking becomes more difficult in certain aspects. Again, when someone looks in a mirror and they see this distorted image, a lot of people around them might say, "What are you talking about? You're not fat. You look very thin." But the person who's looking in the mirror, because of how their brain is compromised, actually sees that distorted image. So they're very, again, stressed over it. And then when others are telling them, "No, you're not," they don't trust other individuals.
Right.
So again, the brain is the biggest part of the body that gets affected. And however, that being said, when that brain is affected, there's a feedback. Our brain talks to all of our other organ system. It talks to our heart and our cardiovascular system, our gastrointestinal tract, our reproductive system, our musculoskeletal system. So when a person has an eating disorder, these different bodily systems are affected, first of all, by the eating disorder itself, because if somebody, let's say with anorexia nervosa, is not taking in enough energy intake with their calories, they can start losing muscle, not just on their arms and legs, but like with your heart and everything.
Really?
So one of the biggest risk factors with an eating disorder is death by cardiovascular conditions. And people think, well, that's just with anorexia, right? Because your heart gets slow, heart rate gets too slow. But people with bulimia nervosa also have significant disturbances. And it's not uncommon to hear of cases where people who, let's say, because bulimia nervosa, you can be at any weight, really, will go to bed, but because of the stress of the eating disorder that it puts on the body itself, die in their sleep because their heart stops. It's a very scary condition. And again, eating disorders have that high, secondary to heroin use. It's the largest cause of death in the field of psychiatry is with eating disorders. So it can really affect all different parts of the body. And in one individual, it may affect their heart. In another individual, it may affect their bones. Osteoporosis and osteopenia are common, so they lose their density in their bones. And for another person, it may be problems with their lungs. So there are multiple
factors.
Right. Multiple factors, multiple regions that the eating disorder ends up affecting with a person's body.
Oh, that's a lot. I mean, I didn't know that. I don't know that it affects a person's body that way.
Yeah, I mean, that's what people think. It's just about weight or something like that. And again, it's really how it's everything the body needs to function in a certain way. With anorexia nervosa, you start to deprive it. And then with bulimia nervosa, the behaviors themselves, the binging and the purging, puts tremendous stress. I was talking with a patient yesterday who said, yes, I vomit, and we were kind of going into how the act itself is a very violent act to the body. It's very stressful. It's hard to be vomiting. You don't feel well afterwards. You get very irritable. You get very fatigued. And you're really, when somebody does that on a regular basis, when we swallow food, the process that pushes us all the way down and through our system is called peristalsis. But when somebody starts engaging in, let's say, purging behaviors where they're vomiting and bringing up the food, you can actually retrain the peristalsis in our gastrointestinal tract to reverse itself. So you're training the neurons to go in the opposite direction, okay? And then down the road, they have things like gastroparesis, where the peristalsis that it's supposed to happen just isn't happening. So they get cramps and abdominal pains and constipation. So it really, even the behaviors have a direct consequence on the individual who's suffering.
Oh, wow. How does it change your personality?
Oh, yes. Look, when you do things and it's altering your brain, your personality is going to change with it. There's consequences. So and that's because, for instance, a lot of people with anorexia nervosa, they become very irritable and emotionally dysregulated, short-tempered. What people will say to me is, this is not my spouse, this is not my child, they're a different person.
Mm.
And there's a region of the brain, it's called the anterior cingulate cortex, which they've shown in many people you get cellular volume loss in that region of the brain. And this is a part of the brain where it's described as where cool emotions meet heated rationale. Okay, so it's where normally we can rationalize and stay calm, and that kind of gets turned off for the time being. And a person their personality will change with that. And there are personality characteristics that are very common to eating disorders, such as perfectionism.
Mm.
And so a lot of people with eating disorders, they're straight A students. They appear on the outside that everything is perfect with them, and they need to feel that feeling of trying to be perfect. And what happens is on the inside, they know they're suffering and they don't feel it. So they're kind of putting on this outside image
Mm-hmm. A
that
facade.
everything,
Mm-hmm.
right, that it's great. And inside they're not feeling that way. So that's going to lead to depression and anxiety disorders. And it becomes this vicious cycle for the individual to try to maintain a certain appearance, meanwhile not trusting that anyone around them may truly know who they are on the inside.
Mm-hmm.
So people will also start to then isolate themselves. It's like, what happened to my friend? She used to be so fun to play with. She wanted to go out all the time. She wanted to, and all of a sudden they're not calling. They don't want to do anything. They're irritable, and they're preoccupied at the same time with all these thoughts. They may be, I can't go out because I have to exercise for 4 hours tonight.
Mm.
So
Really?
there are,
4 hours.
yeah. So there's a lot of things that take place from a personality, and again, because of not just what they're doing, but ultimately changes that take place with how their brain functions.
All right, so we know that anorexia is serious, right?
Right, right.
When who is most vulnerable to it, and when is it that we need to, when we see somebody start, like, self-inducing vomiting, when is it that we need to say, hey, all right, we need to get your help now because of this that you're doing?
Okay. Well, you were saying it's serious. They both can be serious, and what makes one, like the course of an eating disorder, is kind of the longer you've had the eating disorder and the more serious the behaviors are around it, or the lower the weight is some of the factors. Having an early onset, when children develop an eating disorder, they show signs of it. If it's not treated early, um, I go back to that premise of you're starting to wire the brain,
Right.
So if the longer that goes on, the harder it becomes to treat. So very young people is a risk factor when it starts, but it can be at any age. An eating disorder can start. You want to get treatment, or at least an evaluation, as soon as you feel you may be developing that preoccupation with those thoughts. That's a better indicator sometimes than behaviors.
Okay.
Okay, so let's say someone's listening to this, and
Mm-hmm.
right now I say to that individual, what percentage of your daily thoughts where you're not busy doing something do you spend thinking about or worrying about food, body image, calories, exercise, things like that? What you're going to eat later, what you had yesterday, what percentage of your daily thoughts? If an individual is thinking, let me think that through, maybe it's 40-50%. That's a subclinical type of thinking. Okay,
Okay.
you're gonna, because generally speaking, if an individual says, I don't know, 5%, 10%, maybe for adolescents 15%, okay, then that's probably falling in the normal range. That everybody thinks about those things a little bit. When you
Okay.
start getting to more than that, then that's starting to raise some red flags. And of course, if somebody says, that's 80-90% of my daily thoughts, that when I'm not busy doing something, that's really an indication that an eating disorder process may be going on, even if they're normal weight and they don't have a lot of behaviors. Okay. And I think that's one thing I'd like to say is you can have an eating disorder. It is not something you can never look at an individual and say they have an eating disorder. It's not weight. Even if you meet somebody who's 6 foot tall and 80 pounds, they may have anorexia, which is different from anorexia nervosa. They may have anorexia from a medical condition, a hypermetabolism, or something underneath it that is not the eating disorder. So weight is not a factor to think about whether a person has an eating disorder or not.
Oh, okay. That's interesting. We always look at the skinnier people to say, or the slimmer people to say, hey, you have a eating disorder.
Right.
So that kind of changes the mindset of things.
Yeah, it's like I said, it's possible they may, but like I said, there are many people who may be significantly underweight, but due to a different medical cause.
Okay.
Genetics too. I guess when you were asking me what sets someone up is genetics. If someone, studies have shown basically people, you're not going to get an eating disorder just because somebody commented on your appearance or the media encourages thinness. You have to still be genetically prone for the most part. And usually things like trauma and things like that trigger that genetics that causes an eating disorder to develop. And if somebody asks me, well, why do I have an eating disorder? If you look at all the studies, on average, about 60% of the onset is caused by hereditary factors, something in your genetics.
Okay. That's also an interesting news. I didn't know that also before. So that's good. How can family members and friends support persons having these eating disorders?
Yeah, that's one of the most difficult questions that I get asked. I always think when someone's in my office and their family's there and they say, what can I do to help? Because you really want to help when you see someone suffering so bad, but I have to always start off with a few things that they shouldn't be doing. Okay. Not to be the food police. Okay.
Oh boy, that's hard.
Right. There are treatments for children and adolescents. It's called the Maudsley approach, where parents kind of take over their young children's eating patterns and behaviors, and that's a whole technique. But for the most part, commenting on food, commenting on weight is not a good thing to do because it gets twisted in the mind of somebody with an eating disorder. That's why I have to caution people, like if you wake up and you say to, let's say someone's daughter is suffering with their eating disorder and they have that body image and you say, you look good today. What the patients will say is, my mom said I look fat today.
Oh boy.
If you say you look healthy means you look fat.
Oh boy.
So people will say, well, what do I say? And I say, look at the individual and comment about how you think they feel. Like, you look happy today or you look upset today. Okay.
Oh, okay.
So there is this tricky language that kind of takes place, and it almost is like you're walking on eggshells.
Oh yes.
And you're going to probably crack some of those eggshells, even with good intentions, But what they need, I think, for support, the best thing someone can do is to find specialists. Okay. So a lot of people think, well, it's an eating issue, right? Let me find a nutritionist. I always say that it's more than an eating issue. It's really a medical psychiatric issue. So you have to have a doctor who's good at knowing what to follow, checking labs, checking EKGs, risk factors, and seeing a patient regularly if their eating disorder is very serious. A therapist needs to specialize in eating disorders. It is a tricky language, and there are things that therapists who are untrained sometimes may say that actually does more harm.
I agree with that.
So you want to kind of like look at organizations like International Association of Eating Disorder Professionals, IADEPT, and see if, like, online they may have a list of people in someone's area that specialize in it. or NEDA, National Eating Disorders Association. See if there's people on that specialize. And always first try to find a specialist. Even when you're finding a nutritionist, every nutritionist often says, "Oh, I treat eating disorders." The thing is, most nutritionists mostly treat disordered eating, okay?
Oh,
Because an
okay.
eating disorder is a specialty. There are so many things different. You don't weigh patients generally all the time. You really have to be careful whether you even discuss the numbers, you know? Um, you tend to not want to put eating disorder patients with anorexia or bulimia on
Mm.
caloric type of diets. It's learning how to eat. It's called the exchange systems. How many proteins, how many carbohydrates, you know, and so and a nutritionist who specializes in eating disorders understands the lingo also to not kind of trigger the patient. So usually what we're trying to do is we want all food to be okay. Okay, everything's fine in moderation.
Right.
So if an eating disorder patient may say, "Well, listen, I'd like to um, eat healthy," those aren't words. We don't use words like healthy foods, not healthy foods,
Oh.
good foods, bad foods. Not with an eating disorder. In fact, usually the person in their head already has a very rigid good foods, bad foods, which are mostly bad foods. So, you know, you have to change the thought process to
What
change
was, so what
that.
words do you use?
Well, you're using every clinician is going to use a slight version of words, but like I said, a nutritionist will often work with somebody and use what's called an exchange program, which
Mm-hmm.
means we need you to consume 3 exchanges of carbohydrates for lunch, 2 proteins, 1 fat, and then they're taught like what foods fall under those categories, and they have to have, as you develop that treatment plan, the number of exchanges required at each meal to kind of rehabilitate the eating process, because that's what it is. The whole thing with eating disorder treatment is rehabilitation.
Right.
So yeah, so it's a totally different approach than somebody who says, "I have disordered eating, I need to go in, I want to talk to my nutritionist and get a diet." That would be a completely ineffective approach,
Mm.
because again, an eating disorder is not about food. It is not about body image or weight. Those are all things that someone uses to feel a sense of control in their life most of the time,
Mm.
especially when they feel their outside real world life is out of control or difficult to control.
Okay, that's interesting. So basically, family and friends also need to have some patience while dealing with persons who are going through this.
Yes, yes. Without it, that's so. Yeah, so that's the biggest thing with how do I support someone is really find them specialists. You know, and that becomes very difficult in today's world, especially when we're talking about not just what's available in certain areas, because some people live in parts of the country and of the world where they don't have access to professionals.
Right.
But the other big component is it's hard to find professionals with insurance. It's hard to find, right, a lot of doctors and
Right.
professionals these
Right.
days. So it becomes almost a more difficult task, and because eating disorders are much more difficult type of thing to treat, it's more time consuming. So a lot of professionals don't accept insurance because they can't get reimbursed for the amount of time that's involved
Oh boy.
in the treatment of an eating disorder. It's so labor intensive, you know.
Yeah, it's a lot. It's a lot.
Yeah, but I don't want people to feel hopeless, you
I mean,
know.
yeah, we don't want them to feel hopeless, and I'm just saying it's a lot of work. And the thing is, if they're not willing to also put in the work to get better,
Right,
sometimes you won't really yield fruit from it. So they
right.
also have to understand that hey, they need to get better. There's a problem. The first thing is to identify that I have a problem.
Yes, but even when everyone with an eating disorder knows they have that issue, and I can tell you from all the patients over the years I worked with, if they would say, for the most part, well, I'm saying 99 point something percentage of patients, if I said, if you could wake up tomorrow without your eating disorder, without those thoughts, would you do it? They would say yes. They don't want to have it, but they're paralyzed with fear of sometimes just having a meal, having something, a new food. It's like once I learned from a patient something I heard, and I always say this because it just clicked. She said, I was struggling with eating. I said I wanted to get better. My dad said, well, then why don't you just eat? And the girl
Wow.
said to her father, that's like telling someone who's drowning, why don't you just swim?
Yeah. Yeah.
It doesn't quite work that way.
Yeah.
It's paralyzing. Even when someone gets straight A's in something like chemistry and physics, and they're brilliant, and you put something like a hamburger in front of somebody, in their head they're saying, if I eat this hamburger, I'm going to gain 5 pounds or 10
Mm-hmm.
pounds,
Mm-hmm.
even though the chemistry and physics of it doesn't work that way. So it's you know the most intelligent, well-meaning individual can't, when it comes to the actual aspect of what they need to do to recover with an eating disorder, they get paralyzed. So that's what makes treatment hard, because then the person feels everyone's mad at them, and sometimes they are, and because if you have never been through it, a loved one, a parent, a friend, they don't understand. I don't
Right.
understand why you can't eat that.
Right.
And I always say it's kind of like, if I asked, sometimes at a conference, and I actually once brought up this giant refrigerator box, and I said, I want to show you what it's like to have an eating disorder. Can I have a volunteer? And a mom came up, and as she came up, I said, here's what I want you to do. I said, are you afraid of snakes and spiders? And of course she was. And I said, but if I tell you right now in this box, I have 100 non-venomous, non-biting snakes and spiders, and I want you to get in this box for 1 minute just to show you it's okay. And of course, everyone in the audience face dropped.
Mm-hmm.
And I said, that is actually that feeling when we put, let's say, a sandwich or a hamburger in front of someone really struggling with anorexia nervosa, and we say,
Right.
just have this. It's a paralyzing feeling.
Yes. Yes.
So it takes time. I always do say, even if I have that box with 100 snakes and spiders, Jade, even you, I could get you to get into that
Oh no,
box.
you won't.
I could. I could. If you let me work with you, I can get you in the box.
Oh man,
So,
oh man. Well, that's a good example. We didn't look at it like that before. You
so
know,
yeah.
yeah, didn't look at it like that before. So that's good. So, doctor, where is it that we can find you?
Uh, well, don't come to my house, but
Oh
uh,
man.
on my websites, DrDeSarbo.com. So it's DrDeSarbo. That's DrDeSarbo.com is my website.
Mm-hmm.
My treatment place is called ED180. So ED hyphen or dash, I guess it is 180, or you can just
Yeah.
write ED180.com works too. Um, I think if people want to know more, and especially with the neuroscience aspects of it, because
Mm-hmm.
I think that opens people's eyes a lot.
Mm-hmm.
On YouTube, if they just type in Dr. DeSarbo and eating disorders, I have a whole YouTube page that I put up for people during the pandemic just to keep getting educated, because the pandemic had caused such an increase in eating disorders and the severity of them.
Wow.
So I used to do a lot of talks, and I there's actually like I put a 15-part video series, and it's in different categories: bulimia, anorexia, binge eating, different things.
Yes, I've been listening to them.
Oh, okay, great. And yeah, so I put a lot there, and I really put that up there for people to really do a great amount of education on it. And I think if people want, I'm on Facebook at DeSarbo Psych, Psych. So you can find me somewheres on on the internet.
That's fine. That's
So,
fine. That's fine. We'll look it up. Thank you so much, doctor. We really appreciate it. I mean, I've learned a lot, and I'm sure the listeners also have learned, especially within the neuroscience and
oh,
how the brain affects it, because that I did not know.
yeah.
So,
And again, for me, it's in fact, when people say what is recovery? Recovery is when you restore your brain and how it functions back to its baseline. Okay. And again, last thing I'd just like to say is eating disorders are treatable. even the hardest ones. It's if someone's been struggling for a long time and they're feeling hopeless or nothing has helped, you just haven't gotten to somebody yet who's, found the secret combination. So
Wow. Okay. So, yeah, can be helped. It may seem tough, but it can be helped. It will take
yes,
time, but it really does
yes, it
can be
will
helped.
take time. Yes.
Okay. Okay. Awesome. So, thank you again so much for this, Doctor. Really
Oh,
appreciate it.
absolutely.
Yes.
My pleasure,
And
Jade.
yes, and I really enjoyed having you here. And thank you again, guys, for listening to the Unfiltered by Jade. We'll be back next week, Tuesday. Thank you.
Bam bam bide, bam bam bide, badu bidi, bam bam bide.